Hemoptysis, which means coughing out blood, is a very common symptom in patients having chronic lung disease. Almost 1 in every 10 patients who have some lung disorder will have some grade of hemoptysis. The most common causes are tuberculosis, chronic bronchitis, asthma, and in some cases congenital heart diseases and cancers as well. So let us see where this blood actually comes from and how we control it with a small procedure called bronchial artery embolization. Hi, I am Dr. Vineeth, Interventional Radiologist, Narayana Hospital, Bangalore. Lungs, the organ responsible for exchanging carbon dioxide to oxygen in our blood, gets its blood supply in two different ways. First, the majority 85% of the blood comes from the right heart through pulmonary artery. This system carries blood with carbon dioxide and it goes into the lungs for oxygenation. This system is under low pressure, let's say around 20 millimeters of mercury, and bleeding from this system is very rare, and even if this system bleeds, the low pressure itself is sufficient to form the clot and stop the bleeding. The second one is the culprit one, the bronchial circulation. Approximately 10% of blood comes from this bronchial circulation, which directly arises from aorta, which is supplied from the left ventricle under high pressure, let's say around 100 to 120 millimeters of mercury. In normal people, these bronchial arteries are ultra small, less than 1.2 millimeter in size, and are barely seen on normal CT scan. These arteries course parallel to the bronchioles, the air passage system which carries oxygen into our body and takes out the carbon dioxide. In patients with lung disorders like chronic bronchitis, asthma or TB, the continued inflammation in the airways causes its dilatation, leading to what we call as bronchiectasis. This inflammation also carries on to the blood vessels which lie alongside the bronchioles, that is bronchial arteries, and because of the high pressure, these bronchial arteries give way and they bleed into the bronchioles that lie adjacent to it, which is then coughed out as blood. So what is bronchial artery embolization? In this procedure, we make a tiny hole in the artery which is supplying your leg or in your hand. We use fluoroscopy to navigate our catheters all the way up into the bronchial arteries, do angiogram and take a small microcatheter into it and put glue or PVA particles. Glue in the sense medical grade glue, what we call as N-butyl cyanoacrylate mixed with lipidol, which permanently blocks the vessel and decreases the chances of bleeding. So the next question comes is, what happens if we block this vessel? This vessel will have some work to do, and what happens to that work? Who will supply to that area which is supplied by these bronchial arteries? And are there any side effects of these bronchial artery embolization? Answer is, there are no side effects of this bronchial artery embolization. The area which is supplied by these bronchial arteries are now supplied by some good arteries, some good collaterals, and the pulmonary circulation which is responsible for exchange of carbon dioxide to oxygen in our body, that remains intact, unharmed, unhampered. What if these arteries are not blocked? They will continue to bleed into the bronchioles, that is airways, initially small in quantity, and one fine day in such large quantity that it is enough to cause asphyxiation, that is blockage of airways, fall in BP and hemodynamic shock with collapsed airways. To avoid such critical events, consult your nearest interventional radiologist if you have blood in your cough. Share, subscribe and follow to know more. Thank you.